There's been a lot of discussion lately in the conservative media, radio and internet, about the public option of healthcare reform. So I'm not going to say anything new or original here, but I did think it was important to emphasize how bad the public option will be. The public option will simply be another program along the lines of Medicare, Medicaid, VA, or S-CHIP, in that it will be taxpayer subsidized and government managed. But unlike those programs, there won't be an age requirement or an income limit or a requirement that you have served in the military. It will take all comers. There are two evils generally predicted with this ginormous distortion of the healthcare market. One is the dumping of employees on the public option by employers who currently offer their employees private insurance, and the second is rationing. The employee dump will come because right now healthcare costs for those companies that offer insurance to their employees, it's a huge cost. It's just a huge amount on their balance sheet. And if they could tell their employees, hey, here's some money, go off and get your insurance from the government, and then wash their hands of healthcare costs, they would. Then what happens next is the public option with this huge government-sponsored advantage would just eat the private players up, eat them right out of the bag. With rationing, I just want to say to begin with that adding a huge number, millions of people to a government insurance program will actually increase costs, not decrease them. I've talked about in previous episodes what the Medicare reimbursement rate does to the market. In most cases, it's below market or below cost. But physicians and other medical providers have figured out a way to pick up the slack. They charge higher prices for the same services to privately or uninsured patients. Sometimes they just offer more Medicare services. They make up in margin what they've lost in volume. But what happens with the public option and millions more people have moved from the private or uninsured column to the government column? Remember, they're not paid the entire amount. So where do the physicians pick up the slack then? There won't be a way to pick up the slack. And if you're going to lose money on every patient walking through the door, there will be less health care. And that's very, very bad.